Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be reviewing some of the different outcome measures used to assess balance, which we can then utilize with our patients. So here's the question. A 76-year-old patient reports losing balance when turning their head while walking in the community. Which balance outcome measure would be the most appropriate to assess this patient? Is it option A, Berg Balance Scale? Option B, Timed Up and Go, or TUG? Option C, Dynamic Gait Index, or DGI? Or is it option D, Functional Reach Test? Okay, let's review each of these outcome measures to get a better idea of what they're used to assess. So option A was our Berg Balance Scale. This scale is great for overall balance, but it doesn't necessarily test walking, specifically with head turns. So at this point, let's cross off option A. Now we have option B, our Timed Up and Go, or our TUG test. This is a quick fall risk measure, but it's utilized with our patients walking straight with a turn. There would be no head movement challenge here. So although it incorporates walking, it does not incorporate head movement, so we can cross off option B. Next up, we have option C, our Dynamic Gait Index, or DGI. DGI is utilized specifically for gait under challenges, such as obstacle navigation, stairs, and head turns. So DGI, or Dynamic Gait Index, seems like a great option choice. But let's look at Functional Reach Test first, which was option D. Our Functional Reach Test is utilized with a forward reach only. This is testing the distance for a forward reach. No gait components are involved here, which does conclude that option C, our Dynamic Gait Index, or DGI, would be the most appropriate outcome measure here to assess for balance, especially incorporating gait with head turns. Great job, Warriors. So why does this matter? Balance outcome measures are used to standardize fall risk assessment and guide treatment planning. So let me repeat that again. Balance outcome measures are used to standardize fall risk assessment. That's key. Now, on the NPTE, you're expected to know how which test fits within various clinical situations. For example, is the patient standing still or walking? Are they using an assistive device? Do you need a comprehensive test or just a more focused, specific test? It's about matching the patient's challenges or complaints to the test purpose. So let's hone in on some summary and key points. Remember, our Berg Balance Scale is a broad assessment, incorporating both static and dynamic tests. No assistive devices are allowed with our Berg Balance Scale. And a score of less than 45 indicates a fall risk. Next up, we have our TUG, or our Timed Up and Go test. This involves our patients to start sitting, stand, walk 3 meters, turn, walk back, and sit in that chair. Assistive devices are allowed with the TUG test. A test of greater than 12 to 14 seconds does indicate a fall risk, depending on age. Next up, we have our Dynamic Gait Index, or DGI. This is all looking at gait adaptability. Remember, it's incorporating gait with head turns, obstacles, stairs. A score of less than 19 out of 24 indicates a fall risk. And then finally, we have that functional reach test. Our functional reach test is a static balance test only. It involves our patients standing in place and trying to reach forward. We're trying to assess how many inches they are able to reach forward. And a score of less than 10 inches indicates a fall risk. So on the boards, they will give you a clue. Something like head turns, assistive devices being used, looking at static standing or walking. It's your job to pick out all of those clues to best match the outcome measures presented. I hope you found this episode helpful, incorporating a quick review of balance outcome measures. Remember, warriors, you are powerful, you are strong, you are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms such as Facebook, Instagram, Twitter, and TikTok. Have a great day and a powerful tomorrow.